Hello, judges. My name is Edalie Gutierrez from Oklahoma, and I attend Francis Tuttle Technology Center. I've spent countless months preparing for this event, Clinical Specialty. As a pre-nursing student, I felt as if this event could help further my understanding as a registered nurse in my future, which is why I chose this occupation to study. To begin my portfolio, I began my research with an overall but detailed description of the requirements that are involved when pursuing this job, found on page 2 of the portfolio. You will notice that part of the duties as an RN revolves around safety and infection control, health promotion and maintenance, physiosocial integrity, basic care and comfort, pharmacological and parenteral therapies, reduction of risk potential, and physiological adaptation to patient needs. As being part of the healthcare system, the RN must provide medical assistance to prioritize a healthier and adequate life to the patients under the supervision of a physician to ensure a unique care plan for each individual. However, these skills can only be obtained through the intensive training process that comes before the actual job. One of the most beneficial parts of nursing is that there are many career options you can choose to become a registered nurse. If you turn to page 3, you will find the different career courses and paths a student may take to suit their future, such as a licensed practice nurse. This program offers introductions to anatomy and physiology, pharmacology, and most importantly, patient care. To obtain an LPN, you must take and pass a NCLEX PN, which is a test that will determine if you are knowledgeable and competent to care for someone under the supervision of an RN or physician. This program is offered to students who are attempting to get their RN faster than the traditional route, due to the fact that there are many bridge programs from LPN to ADN, which provides associate's degree in nursing. Now, regarding the traditional route, it is a 2-year course in nursing school that is offered by most but not all colleges. You must obtain your ADN, which is your associate's degree in nursing, and depending on what school you are attending, most of the time you will need to take classes such as medical terminology, anatomy and physiology, chemistry, microbiology, and nursing concepts. The difference between an LPN and an RN is that an RN is who supervises the LPN. They also work more diligently with the doctor or physician to accommodate goals in the care plan. Lastly, a Bachelor's of Science in Nursing registered nurse, also known as a BSN RN, typically spends up to 4 years practicing skills regarding a more in-depth scientific and nursing aspect of care to patients, especially in research informatics. They are also allowed to provide assistance to surgeons during complex procedures and have a greater surgical role. With this degree comes prerequisites, just like any other career. However, to obtain a BSN, you must first complete courses such as English Composition, American History and Government, Analytical and Quantitative Thought, Humanities, Natural Sciences, Social and Behavioral Sciences, and additional general education. Now that I know what career options I have, I must also determine how to actually obtain a job as a registered nurse. Well, luckily there are many employment options and settings I could apply to after practicing my studies because there will always be a demand for nurses in the healthcare system. Typically, after submitting a resume and application, the supervisor will go over it and hopefully offer you an interview. They will give you a background check, and then you will go through the formal hiring process depending on where you apply. With that being said, a registered nurse can work for attorneys, companies, schools, surgical centers, and hospitals. As you look through my portfolio, you will notice I spent a total of 15 hours shadowing under the supervision of a registered nurse to further understand the clinical portion of their duties. I was able to identify my personal strengths in the hospital because of the overall environment. I learned that being a team member is vitally important, and luckily for me, I've spent my high school career participating in extracurricular activities that involve teamwork, such as being class president of my student council, being a HOSA member, of course, and volunteering work for companies as Make-A-Wish and Feed the Children. Applying what I learned as a leader was not hard for me in the healthcare setting. In addition, I took advantage of my time in the hospital and made connections. I met an advanced unlicensed assistant, also known as an AUA, who was working under the supervision of the RN I shadowed that day. I learned that being able to communicate effectively when it comes to charting with other members of the team, they can potentially make your job a lot easier. The AUA told me she was planning to transfer to the college I will be attending to next fall to pursue a registered nursing degree, as will I. We both do not know anybody else at the college we plan to attend, but both agree to use each other as resources to study and expand our knowledge together. Additionally, you will find on page 5 a list of skills I gained experience on while with the RN. As a certified nursing assistant and as an upcoming AUA, I felt competent and knowledgeable to perform certain skills such as how to clean ulcers, applying dressings, and monitoring fluid intake. These strengths made it easier to help the patient. In addition, I am familiar with what to expect from the hiring process as I work for a company myself. Therefore, I feel as if I have an advantage in experience when it comes to presenting professionalism when it comes to finding a job. Attached to my portfolio, you will find a skills checklist and a video on how to accurately attain a finger stick glucose test. Lastly, my reference page is attached, and I would like to thank you all for watching my presentation, reading my portfolio, and watching my skill performance video. Thank you for taking the time out of your day to do so. Goodbye.